Hi, everybody. I'm Ed Baker. I'm your host, producer at the Addiction Recovery Channel, or ARC. ARC is a show that is devoted to bringing current and accurate information to the audience, specifically focused on matters related to this brain disease that we call addiction or substance use disorder. The ultimate goal of the program is public education, public consciousness raising, to dispel stigma and one day to actually eradicate a stigma, so that the response to people with substance use disorder would be one of compassion and inclusion, ultimately saving lives. It's my pleasure today to have Jolinda LaClair as our guest.
Thank you, Ed. It's a pleasure to be here today.
And it's a pleasure to have you here, Jolinda. Jolinda is the Director of Drug Prevention Policy at Vermont's Opioid Coordination Council. The council was formed as a result of Governor Scott's second executive order of January 2017. The council has been operating since around May 2017, so not quite 1 year yet. And Jolinda, I thought that a good way to begin would be to give you the opportunity to talk a little bit about the council's goals and the council's makeup.
Well, the goals are specific and broad. This is a 22-member council, and it crosses the 4 drivers of Vermont's response to our opioid challenges. Many say the opioid epidemic or the opioid crisis. What we all know is that whether you are in a family with addiction, you are a person with addiction, you are in a community with addiction, it impacts everyone. There are no socioeconomic dividing lines with this disease. And our response crosses prevention, treatment, recovery, and enforcement. And when I talk about prevention, we must include education and intervention. So we say there are 4 pillars, but there are really 6. The council, as you noted, began in May of 2017. It followed a summit on Vermont's substance use disorder workforce, a challenge that Governor Scott made to the position of Director of Drug Prevention Policy and the Vermont State Colleges, because one of the things that we know is you must have an adequate workforce in order to provide the treatment needed by so many Vermonters. And today we are really proud to say that Vermont has one of the finest medication-assisted treatment programs in the nation, the hub and spoke system, with over 7,000 patients currently in treatment.
Yeah, yes, and I'm with you on that 100%. I'm very proud to be a Vermonter and to be a part of this overall response to this epidemic or tragedy or crisis. The words that you use are so accurate. And it sounds to me that the Commission's goals are enthusiastic and ambitious, and rightfully so, Jolinda, because of the depth and the velocity of this tragedy. So, having been at it now for approximately less than a year, I would imagine that your learning curve has been practically vertical. And I wonder if you'd like to share with us, what are some of the lessons that you are learning this first year?
I think one of the greatest lessons is the breadth as well as depth of people who want to make a difference. And as I said earlier, this is a disease that impacts so many people in the state of Vermont, in this country, across the world. In Vermont, we are able to mobilize, and it's something that has always motivated me, community to community, state government, federal government, local government, nonprofits, the private sector. We do an outstanding job working together. And I think we understand that it is only that cross-sector, multifaceted partnership that will affect change. The first goal you stated was to save lives, and that is so true. We'd like to reduce the number of opioid overdose deaths annually. In 2016, the number was 106. In 2017, we expect that the number will be about similar. And so we need to look at how do we reduce the number of children who are in state custody as a result of addiction in their families. How do we increase the number of people in treatment? How do we increase the number of people in recovery who have access to wraparound supports? How do we strengthen the prevention programs we know that are so critical in our schools and communities? And overall, what can we do to support community-wide initiatives to become more resilient?
Yeah, resilient. What a wonderful, wonderful word. So apropos for us today. I mean, it breaks my heart to look at the statistics, having been in the field for quite a while. I mean, I can remember back in the 90s when there was nothing like this. We had cocaine, we had marijuana, we had alcohol, tobacco, a little bit of very little bit of heroin. But over the past 2 decades, this has been something that has been earth-shattering, and no one's immune. We know that, and I mean, the human condition is sometimes that it takes a threat of this magnitude to create the mobilization that you're describing, that grassroots kind of groundswell of mobilization. I'd like you to, I mean, let me just ask you a question. How many people do you think you've listened to over the past year? Just a rough estimate. How many people have you sat and looked them in the eye and listened to?
Hundreds.
Hundreds.
Hundreds. And I think some of the most impactful for me have been the stories of people's journey to reach recovery. Someone who tells me they have been in and out of a correctional facility, in and out of rehab, lost their children, may have reunited with their children, may not have. At the end of the story about their lives and their experience is this underscore of hope. And I have walked out of now, I think 7 of the 12 recovery centers across the state of Vermont, and felt awed, inspired, and always that commitment to making a difference. One of the things I've done in my 30-year career, most of which has been in the public sector, and it gives me great joy, is to work across sectors, across state agencies, with federal government, with our congressional delegation, and build partnerships to meld resources. So the mission of this council, as noted in the executive order issued by Governor Scott, and as you said, his second executive order. I think that makes a very, very strong statement about his commitment to making sure that government does the best it can to coordinate resources across state agencies, leverage the resources with nonprofits, private sector, could be philanthropy, and drive those resources to the people and communities they need most. And we talk about the children of Vermont being our future, and they are. We're watching children mobilize, youth engagement today as a result of the tragedy that happened once again in a Florida school is powerful. It affects change. Politicians are listening. Community leaders are listening because youth are speaking articulately and passionately about what they want their future to look like. And we have a responsibility to not only listen, but to act. We talk about collective impact, and I really describe that. It's the melding of all the resources. Collective impact means collective action. And so the Opioid Coordination Council in 8 months came up with a set of strategies, crossing these drivers, strengthening prevention in schools, strengthening prevention in communities, doing more for prescriber and patient education, looking at how could we expand syringe exchange programs to meet people who are actively using and may or may not be ready for treatment. Treatment, we talked about medication-assisted treatment, we do well. We can look at other types of treatment, non-pharmacological forms of pain management and treatment, whether it's yoga or acupuncture, chiropractic care, naturopathic care, looking to ways to reduce the number of pills somebody might take as a way to reduce their pain.
That is so encouraging to hear you speak in such an inclusive way. There's so much depth and so much inclusiveness to your view that I feel so encouraged by that. And it brings to me a kind of a feeling of safety, that I feel safe with leaders like you in the positions you're in, because that's what we need. We need leadership, and we need resources, and we need inclusiveness. That's beautiful, Jolinda. Now, you mentioned a couple of things that I just find this really interesting, that you're mentioning needle exchanges, clean needle exchanges. And we know that this prevents the spread of hepatitis C, prevents the spread of HIV/AIDS, prevents the development of diseases such as endocarditis, other infections, blood infections, tissue infections. But if you look just a few years back, the very idea of a clean needle exchange in Vermont was not acceptable. It was a stretch for people's imaginations. And today, it's one of the leading causes of harm reduction. And I spoke with one of the directors of a clean needle exchange yesterday, and she told me that they were responsible for 248 people getting into medication-assisted treatment. So it's also an effective outreach program. Same thing with naloxone. Do you care to speak a little bit about our naloxone program in Vermont?
Well, I'd be happy to. I think I first want to answer a question you asked me earlier, which relates to all of the benefits and the outcomes from a syringe exchange program. This was part of my learning curve. And yes, I had a very steep learning curve. And addiction and the pathways to recovery, it's complicated. It is not a quick response with a quick fix. And again, it's the collective impact and collective action that makes the difference. Naloxone is one of the things that we here in the state are doing a tremendous job at, both training and supply of naloxone to first responders across the state. The health department has a public health mission, and they have a robust program. I believe they have reached, through training and supply, almost every first responder, police, fire, and rescue across the state.
Excellent.
So what's the next step? We know that it may be a friend, it may be a family member, it may be a multifamily housing property somebody is living in, and there's a neighbor who is there before a first responder. And how do we educate people, citizens, to know more about a very simple procedure to provide naloxone to somebody who is overdosing?
That actually saves lives.
It does save
I'm waiting
lives.
for research that shows a number of people whose lives were saved by overdose reversal through naloxone, who went on to engage in treatment and enter into recovery. Those lives that would have lost become lives that are saved, become lives that contribute to this movement. It really is a wonder that that naloxone is available as easily as possible today. I think you cited 106 overdose fatalities in 2016. One of the statistics for that particular year was there was 423 naloxone administrations by lay people. 7 of them were unsuccessful, so 417 lives potentially were saved by naloxone. Imagine what the fatality rate would be without that particular drug.
I don't want to imagine that. However, I can.
Yeah.
And I would say that that number of over 400 lives saved is underreported. And I think that's one of the things that we also know. So where we can enhance our training, we have an initiative, and we will be talking to nonprofit housing providers across the state. Burlington Housing Authority recently trained all of their staff about how to use and administer naloxone.
Beautiful.
And that's a tremendous start. We'll be talking to the Vermont League of Cities and Towns, municipal leaders across the state about points of contact and points of availability for naloxone within their community. That does lead me to the topic of stigma, and you raised that issue earlier. How do we as a state do more to increase public awareness, reduce the shame and the stigma attached to addiction? And it's all addiction. It's, you and I have spoken in the past, you can't silo substances. So whether it is alcohol, or whether it is cocaine, or whether it is heroin, it is important that people can speak up, ask for help, lend a hand to someone they know in need of help, and it means we need to talk about this.
Absolutely. I couldn't agree with you more. And the eradication or the elimination or the reduction of stigma is one of the most potent weapons we have to combat the continuation of substance use, addiction, and fatalities. When people understand that addiction or substance use disorder is not like a voluntary behavior, it's not a choice. It's been determined by genetic factors, by environmental conditions, by inner pain, inner suffering. Nobody really makes a decision to become a person with addiction. It happens usually very gradually. It begins in such an innocent way. Kid might want to fit in with the crowd, or be curious about one drug or another, or maybe even have an opioid prescribed to them. Nobody really decides to live the life that people with addiction live. When the general public understands that, there's not a punitive response. There's more of a compassionate response. When the general public understands that the continuation of behaviors associated with addiction are not a choice, but they're a result of an impaired brain, impaired decision-making, impaired impulse control, not a choice. When the general public understands that, their response is compassionate rather than colored by stigma. It's inclusive. And that really is the point. That's the point of this program. That's inherent in everything you do, in everything your Opioid Coordination Council does. That's why I feel so encouraged, because it's taken on a level. When you go to meetings, you hear people using positive messaging today, correct? People are speaking differently about it. People are feeling differently about it. What's your gauge of the general public? I mean, how do we reach them in more of a massive way rather than a one-on-one way? How do we really begin to infiltrate them and educate them about this?
Well, I think it's like any good campaign, you need to penetrate a message many, many times. And especially in 2018, when we have media coming at us from so many different sources, and we need to filter. I think that there needs to be great stories told about the lives saved, the lives changed. I think that we need to be speaking at the State House, which so many people are. There was Recovery Day 2 weeks ago, And yesterday there was Prevention Day at the State House.
Right.
And these are wonderful opportunities where youth, people in recovery, friends, family, experts, professionals are all talking about the pathways for hope. For prevention, our goal is to have youth never try a substance. And that means youth engagement. It means after school programs, it means curriculum that is embedded in the school, talking about healthy choices. It means opportunities for engagement, no matter what family you are born into or you are in. I think that there are opportunities such as we will have on April 11th at the State House, which will be the second annual Opioid Overdose Awareness Day. We started this last year with Governor Scott. There were two moms from the Northeast Kingdom. They told their stories about their family members who died as a result of an overdose. They were not one of the people we talked about who had a second chance by the delivery of naloxone.
Sure.
I think that there are groups across the state right now that have mobilized as a result of feeling that their voices need to be heard. They need to define better the nexus between treatment and recovery and the community support, which makes it okay to talk about addiction.
Right.
When you speak so eloquently as an expert, most of us are not. Some people have had lived experience, many have not. And so I think part of our job and the job of the Opioid Coordination Council is to continue to communicate effectively and not in such a complex way that we make people feel it's not comfortable to have the dialogue when they might ask a question about why or how that they haven't read the manual.
I just think that's so sensitive. That's so encouraging to me to hear you speak that way. I know we've spoken a number of times, but I never heard you say it quite that way before. That's beautiful and sensitive. That we have to understand that the general public is not supposed to be experts. They're the general public. They're busy surviving, working, paying bills, raising kids, doing whatever you do when you're just a person. They don't have the time to study this. But all of a sudden, there's this tsunami of tragedy engulfing their communities. What they don't know what to do. It's our duty really to figure out ways to talk to them in ways that engage them rather than make them feel like guilty for not knowing. We have to teach them. The other thing that you're saying that I find so encouraging is we have to find ways to educate children so they don't want to experiment with a drug, that these things are dangerous. Beer, such a friendly, beer, or vaping or marijuana, the drugs that have taken on this kind of tone of being like safe recreational drugs. It's not recreation. They're psychoactive chemicals. They operate in your brain, and they can be very dangerous and lead to addiction. Adolescents are the most vulnerable population. We need to get to them consistently over time. Probably, Jolinda, and I think you agree with this, a multi-generational approach. It's probably going to take decades of effort to really stay focused on this and finally do something about it, rather than do something about it, forget it, and then have to do the same thing 15 years from now. People like you and people like your council, I think, are really focused on the importance of commitment, long-term commitment. Do you see that happening out there?
I definitely do, and you talked about safety earlier, and I wanted to use that as a lead into public safety and the commitment that I have heard again and again and again from law enforcement across the state. Law enforcement is the first to say we will never arrest our way out of this problem. They are very clear, whether it is the local police chief whom I met from Brattleboro yesterday, who was recognized at Prevention Day in the State House for his work at the community door to improve our response to this opioid challenge. Or it is Commissioner Tom Anderson, who is one of the chairs of the Opioid Coordination Council. Prevention is the pathway forward. We are always going to focus on supply reduction and harm reduction. If we can engage youth, I heard Chief Del Pozo from Burlington about 6 months ago talk about how he took his son, whom I think was about 7, and walked him along a path in Burlington and was explaining about the people that they saw. And it was age-appropriate education about substance use and mental health and challenge that people face. And as we age into later elementary school, junior high, high school, there are many, many ways to continue to communicate the message and engage families in every case that there are families. So connecting school-based and community-based prevention is another one of our goals. We have prevention programs across the state. There are gaps, and some of the gaps are in some of the most rural regions of the state. If you go to Essex County, which has 6,000 people in the entire county, in a state of about 630,000, gives you an idea of how rural, whether it's accessing treatment, where they have to drive an hour to reach a treatment provider, or an hour to reach a recovery center, or an opportunity to engage with people in their community. We need to think about ways, whether it's using social media, that we can better reach people who are in need of resources.
I can't tell you how much I support everything you're saying. There's a massive approach to the general public in every way possible, and the idea of age-appropriate education, from toddlers, 4th graders, 5th graders, preschoolers, adolescents, just to help them to understand some of the dangers that will be present in their environment. Your mention of law enforcement, I can't tell you that how impressed I am on a regular basis whenever I'm around some of the forward-thinking law enforcement personnel that we're so lucky to have in our area. Chief Del Pozo, Jackie Corbally, his opioid coordinator.
Yes.
Every time Mayor Weinberger, whenever I am at a forum with them, I listen up to what they're saying, and I listen to the questions that they're asking. And again, like you, their learning curve has been practically vertical, and they've mastered it. They've mastered it because they're not fooling around. They're not making believe. They actually do care, and they actually are committed to doing something about it. I think that Chief Del Pozo is a very forward thinker in terms of not only law enforcement but public health. And his assistant, Jackie Corbally, is a gift. This program where they're making home visits to people who have experienced opioid overdose, a special home visit to try to engage someone who's overdosed in treatment. I mean, that to me, you can't get much more forward thinking than that.
That's looking at a problem and applying a response. It's innovative. It may or may not be wildly successful. They are collectively giving it a try. And I think we need to look at new ideas. We need to think about different ways to approach the challenge. Substance use is not a new issue. It's been around forever. We are a more complicated society in 2018. The challenges within our families, the stress everybody feels, You know, if you're lucky to have 2 income earners in a family, most families are stressed and stretched, and they're trying to do their best to raise children, to make sure that the basic needs are met, and then to have a quality of life. I absolutely commend the city of Burlington. I commend the city of Rutland. City of Rutland, as the governor noted in the executive order, Project Vision was one of the first to come up with a community response. It was the mayor's office, it was the police department, it was the regional medical center, which convened after another horrific death. And it oftentimes takes crisis for us to mobilize and for us to say, enough. We need to take our resources. No, there are never enough resources. However, we can be smarter about our integration of the resources that are being utilized. And it's our responsibility as state leaders to always be rechecking the programs we are delivering. When times change, it means you need a reassessment of how are you doing? Are you meeting your goals? Are you doing what results-based accountability asks us? Are you making a difference? And if yes, great, we don't need to reinvent the wheel. If no, then we need to rethink how we are deploying the resources.
You know, it's so wonderful to hear you speak that way. One of the things that you just mentioned was that the project at the Burlington Police Department may not be wildly successful.
But it may be.
It may be. But one of the things that I see is that this particular, if you take the population of people with this brain disease that we call addiction or substance use disorder, it is a completely isolated, stigmatized population that is frightened to come forward for help. They don't trust anyone. They don't really trust the systems. Some of the fear is well-founded because what some people are doing is illegal. Some is imagined, some is overblown, but there's this feeling of isolation. Some of it comes as a result of stigma being placed on them. Everything you do and everything your council does, this show, Brendan Del Pozo's and Jackie Corbali's program, they have one thing in common, whether they work wildly or have to be modified over time. There's a clear message that's sent out. The message is, we really care. We care so much that we're willing to spend our lives doing this. We're willing to find new ways to reach you. We're willing to have the legislature commit funds to develop ways to help you. There's a true message in that. Yes. Somebody once told me, they said, we won't care about how much you know until we know how much you care. And that I think is one of the most wonderful accomplishments of what we're doing today, is we're letting people know we care about you. We're setting the stage for them to come forward, for treatment, for naloxone, for clean needles, for help, for health.
So everything you're saying about wraparound support and care and compassion, I want to make sure we talk for a minute about mothers with addiction and their children. Most women with addiction have been screened and then identified for a substance use disorder and are in treatment. Importantly, they need support, prenatal, through birth, and on their way home, and then once in the home. The governor proposed an expansion of universal home visits for all moms across the state, and in particular, a strengthening of nurse home visits for mothers with addiction. The council is also talking about attaching a recovery coach, connecting a recovery coach to every mom with addiction. And the Turning Point Center in Burlington is embarking on this initiative right now. We know, and I just visited the Chittenden County Correctional Center, which has a partnership, an incredible partnership with the Lund Center here in Chittenden County, which is one of the greatest resources for women and children and families, making sure that they get the wraparound supports that they need, all through pre to postnatal, and then home with their children, connecting to housing, to employment, to the health care and social supports needed. We have an opportunity to turn the curve and better connect resources, some which exist, some which we may need to amplify over time, right now to mothers with addiction and their children.
I mean, talk about a vulnerable population.
Very.
That's the most vulnerable population within the vulnerable population. So thank you to you and other people focusing specifically on that population. That's beautiful. Lives will be saved. And as we know, sometimes addiction can become kind of a cyclical, generational, within the same family phenomenon. So it's a chance to break that. Thank you for that.
Yeah.
I wanted to thank you, sincerely thank you for coming on the show and finding the time to come on the show, and to give you the opportunity to begin the close of the show with your own words to our audience, Jolinda.
Well, I think it was some of the things that I said earlier. What I have learned in the past year is that the commitment across sectors from people throughout the state is to turn this curve and to invest, whether it's themselves individually, whether it is through their business. I am so impressed by many employers who employ people in recovery and understand that they may need to modify their policies to support people in recovery. Employers also will be the first to say that employees in recovery are oftentimes their best employees, the most dedicated. I think that there is always hope, and that we need to be forgiving for people who may not have the accurate language that talks about addiction as a disease and substance use disorders, however, whose heart and whose actions are to do the right thing. And I think if collectively we work as leaders across the state, we work with our youth, whom we cannot help but be impressed with how they're standing up and articulating a message about the future of this world and the state of Vermont, we will affect change. So I am a great believer we can break down silos, we can better connect resources, and we can drive what is needed to people, communities, and families in need.
Well said, my friend.
Yeah, thank you very much, Ed, for having me on the show.
Thank you for being on the show. I'd like to say in closing to the audience that, one of the points that Jolinda is making is that we need public involvement, that everyone has something to offer. And we do care, and you do care. And anything that you can think of, any way that you can think of to contribute. I was recently at the Recovery Day in Montpelier, and there was a young gentleman there that is going to actually run the Long Trail, if you can imagine that. He will run the Long Trail as a fundraiser. I think the money will go to the Vermont Recovery Network, a fundraiser for recovery in Vermont. He's just an example of someone who, wants to get involved, and along with his capacity, that's what he can do. I'd like to appeal to the audience to think about what you can do. Certainly, watching the show is one thing, educating yourselves, going to community forums where there are community leaders, asking the questions. Don't be afraid to ask the questions. Jolinda was so sensitive about that. We have no expectation. If people are not educated about this subject, it's okay. This is a community experience where we'll all grow together. One of the ideas that we had today for the first time on this show is, you'll see a slide now that has the Vermont Recovery Network website listed on it. The Vermont Recovery Network is a system of 12 recovery programs, recovery centers that are located in Vermont. These are safe places for people seeking recovery to congregate. There are places where Alcoholics Anonymous, Narcotics Anonymous, yoga, different types of education, childcare, celebrations of holidays, food, just safe places for people with substance use disorder or their families to be together. They're funded on a shoestring. The funding is it's what the state can do, but they can use as many donations as possible. So if anybody out there has a few dollars, no donation is too small or too large, and they'd like to help in that way, the information is on the screen now. So next month we'll have Brendan Del Pozo, the Chief of Police from Burlington Police Department, will be here, and we'll be looking forward to seeing you then. Thank you.